Hi, my name is Tracy Hull. I'm a registered dietitian. I own a private practice and I work with all kinds of clients, including clients on GLP-1 medications, off of GLP-1 medications. I'm happy to see you here on my channel. Thanks for checking out this video. We're going to talk about GLP-1 medications and how they're used in binge eating disorder. What exactly is binge eating disorder? And can they be helpful, or is it controversial for a good reason because they are not appropriate for use in an eating disorder? So can GLP-1s help? And this can be controversial, honestly. We're going to cover all of that today, so let's get started. A lot of people assume that going on a GLP-1 is an automatic fix for binge eating. In my work and in my office, that's certainly not what I see, especially if we're not understanding the underlying behavior of the binge eating. The other thing to consider is we use the term binge eating for a lot of different behaviors. I work with a lot of clients with binge eating. They may come to me saying that they have binge eating behavior. They may even carry a diagnosis of binge eating disorder. We're going to go into exactly what binge eating disorder is, and then maybe what some of these other behaviors that you're seeing are, and sort of separate them. We're also going to discuss how GLP-1s could help or maybe even hurt any sort of binging or impulsive, compulsive eating behaviors, and how binge eating may still be possible even if you're on a medication that completely floors your appetite. With my clients, usually before we even talk about medication, we're exploring behaviors, thoughts around food, feelings around food, shame, guilt, and nighttime eating seems to be pretty classic. The most important thing, and I feel like for my clients, is that when I slow down with them and really talk to them and get to know why exactly they're eating the things that they're eating, what does the behavior feel like internally? What is the amount of food that they're eating at one time? What is the time frame? I can better understand really what's going on inside of their head and their body. And sometimes we can fix their binge eating or what they feel is binge eating pretty quickly. There can be some pretty obvious triggers. But today we're talking specifically about binge eating behavior with GLP-1 medications. I think if we introduce medication way too early and we don't have the nutrition behaviors and patterns better understood, and I don't want to say controlled, but normalized, regulated, not feeling as out of control, the GLP-1 is really just a Band-Aid and it's going to come out in some other way. Now, I'm sure there's somebody out there who certainly had significant binging, went on a GLP-1, and all of a sudden they feel fixed. And that's wonderful. I'm just saying in my practice, the way that I practice is really diving in to look at the behaviors. So we're using a GLP-1 as a tool and not as the fix. For instance, I have some clients who come to me and we've worked together for quite a long time, and then they eventually get on a GLP-1. And this could be somebody, and has been a few of my clients, who do have diagnosed binge eating disorder. So does a GLP-1 fix this? No, it doesn't. A GLP-1 can absolutely help with binge eating. It can help with impulsive eating for sure. There are other medications as well. Vyvanse can be used for binge eating disorder and impulsive eating. But at the root of it, there's some other cause of the binge eating, or the perceived, I'm just going to call it binge eating from now on, because we already went over that. From this point on in the video, I'm just going to call it binge eating, but know that it may not be actually clinical binge eating. Just because you're on a GLP-1 doesn't mean you're going to stop that behavior. The behavior happens for a reason. It happens usually, can be, like I mentioned earlier, because of restriction. You're not eating enough earlier in the day, earlier in the week, or earlier in the month, and your body catches up with you, and all of a sudden it leads to impulsive behaviors, because it becomes this like caveman-like thing, right? It's this survival, I must eat at all costs. I have to seek out the most calorically dense, high fat, high salt, high sugar food possible. That's not you. That's biology, chemistry, physiology, all the things. So a GLP-1 can lower your appetite. It can lower your impulsive eating behaviors. At the same time, what I see is if people are not eating enough overall, they will start to eat foods maybe that are less healthful for them. So they may eat more readily available foods, maybe more processed foods, higher sugar foods. And eventually, if they get hungry enough, they can still exhibit impulsive, compulsive, binge eating like behavior. Emotional eating is a whole nother bear. So if you're on a GLP-1, you may find food less appealing. You may find that you're not as hungry. But we know with emotional eating, it doesn't have to do with hunger. It has to do with the emotions driving the behavior. So you can still be sad on a GLP-1 and still seek food for comfort, regardless. And so working through that behavior is really what's going to change. The medication can help us to work through the behavior and help to see patterns a little bit more clearly, or help you have more confidence in making those changes, but it's not going to fix it for you. Quick overview on different, definitions of eating behaviors. So impulsive eating is going to be impulsive. It's going to be reactive. I see something, I eat it. I see cookies on the table, I automatically eat them without even realizing it or thinking about it, or it happens too quickly and I feel like I can't stop it. I see this kind of as like a normal behavior in a lot of my clients. It's so common in general. So I see something and I eat it, seafood, I see it, I eat it, or snacking without awareness. So, I didn't realize I was cooking dinner and I'm snacking on the food while I'm cooking it. And then by the time I get to the meal, I'm not even hungry anymore because I've been eating the entire time. The other one is eating past the point of fullness because of distraction. Again, so common. This can be, it doesn't even have to be like considered bad, right? I guess I think of eating in front of the TV or going to the movie theater and you buy a thing of popcorn and you're just eating it and you've eaten the entire thing of popcorn before the movie even started and you just got through the ads. Like that can very much be this impulsive eating. Very common, right? Who hasn't done that? I have totally done that. So the difference with this is it's common, it's human behavior, it's a normal behavior, and it's not a disorder. The important thing here is GLP-1s actually can be quite effective when it comes to impulsive eating. I also mentioned some other medications can be effective as well because GLP-1s lower appetite and they lower food noise, food thoughts, food focus, and desire for food. Because the appetite and the food noise are reduced, then you're able to act on the impulse less. The impulse just doesn't come up as often. Emotional eating is used for stress release, distraction, emotional distress. It can also, what I find is, it can also be, I'm going to eat because I'm happy. I'm going to eat because we're celebrating. I'm going to eat because, I passed this thing, or I'm going to eat because I failed this thing. It's like every single emotion deserves an eating celebration or justification for it. And then we're just eating all the time, right? We're just eating just to eat. A lot of the chemicals or things found in food, the fat content of food is naturally soothing. Carbohydrates are naturally soothing or sedating. They might actually reduce anxiety as well. And if you're really, really hungry too, you can actually feel increased anxiety. And so then eating can help to calm that. So it's a natural human behavior. It just doesn't always feel good. And certainly society makes us think that we need to only deal with our emotions by dealing with our emotions and not seeking out food. And again, I find this personally even challenging. It's not bad. It just doesn't always feel good to do it all the time. And you might not like to do it all the time. You may not like the outcomes of it. And so that's where, I work with clients on, well, how distressing is this? Or are there other things that we can do instead of seeking food? And the most important thing is if you seek food for comfort emotionally, that's okay. There isn't shame and guilt in it because the shame and the guilt makes it 1,000 times worse. And you don't deserve to live in shame and guilt. So if we can, okay, I ate emotionally, I ate because I was emotional. Okay. And you move on. Like, don't sit in that stuff. To sort of summarize that, it's a problem when it becomes the only coping mechanism that you have or use. you just seek food when you experience anything, or when you always experience sadness, you always seek out food instead of using other tools, and when shame / guilt or guilt enter the picture. So binge eating, classified clinical binge eating, is not just overeating. There's a whole lot more to it than that. Usually binge eating, in order to meet criteria for binge eating disorder, there needs to be this sense of lack of control. There usually is some sort of impulsivity to it, but oftentimes there's pre-planning to it. And that can be some of the most exhilarating parts of binge eating, is the planning. I am planning the binge, I'm going out to purchase the food, or I am, making this one thing in particular so that I can plan to overeat on it. And I'm going to wait till this person leaves the house so I am by myself because I feel shame and guilt about eating the massive amount of food I'm going to eat very quickly. So you could hear there are many different things. Shame and guilt, large amounts of food, larger than what most people would eat in a similar amount of time under similar circumstances, which can be a bit of a gray area. So shame, guilt, larger amount of food, eating very quickly, often eating in solitude. So while nobody else is around, sometimes waiting for people to leave or hiding away, maybe hiding food underneath your bed or in your closet, eating in the car, potentially hiding evidence. There's a lot of, shame-like behaviors around it. Eating past the point of fullness, sometimes to the point of nausea, distress, feeling almost dissociated, checked out, not there anymore, not present while things are happening, not present while you're eating. It can be numbing out for multiple different reasons. It can be numbing out to avoid emotions, but it doesn't have to be. It can become just part of, this is my habit, I binge, and now it's just gotten away and it continues to happen. And not all people who binge eat are overweight, and not all overweight people binge eat. So we can't make assumptions like that. Binge eating is not a willpower problem. There's so much more to it than that. And so you can't just tell somebody who exhibits binge eating oh, you just need to try harder. You think they haven't tried? You think they haven't tried a million times? They probably try harder than anybody else at not doing that. And yet they just find themselves still doing it. And that also makes it worse. So getting to the bottom of the binge eating disorder, figuring out what mechanism is going on, what is triggering this, what's the environment, are we making sure that you're fed, throughout the day? Are you getting enough nutrition? Can we normalize nutrition? Can there be regular eating, adequate eating? And then it's really beautiful to see the binge eating normalize, which is great. And that's without a use of a GLP-1. So can GLP-1s help? Across all of these things that we've talked about, yes, they can help. They can help reduce food focus, food noise, appetite. And for a lot of people, that is a huge, huge relief. And so I think that and this can be controversial, honestly, come for me and comment if you think, because I read in the eating disorder community, there's a lot of fear around using GLP-1s, as I said in my last video about being prescribed a GLP-1, or, you're prescribed a GLP-1, now what? When you use these medications, it needs to be used with huge responsibility. So the same is true with using it with an eating disorder, binge eating disorder. It's not just a Band-Aid, it's not just a fix, and eating disorders can shift as well. So we want to make sure that it's used as part of a program, part of a healthy balance. Of course, I'm always biased. That involves a dietitian who knows how to work with body image disordered eating and GLP-1 medications, but they can be tremendously helpful. It's really cool with some of my clients who have binge eating disorder, who have started GLP-1 meds after a long time of working on behaviors beforehand, normalizing eating, as I mentioned before, adequacy, and raising awareness around when we're triggered to want to binge. And then we add the GLP-1 as another layer, and it's just really cool just to see the stress relief and the ability for those clients to then hone in even more on body signals. It reduces their inflammation, so maybe they can get more active as well. And if they have been working on weight loss, they can see that. We don't focus on the weight loss as, I know it seems silly, We don't focus on the weight loss as the reason for the GLP-1 necessarily, but it's just to sort of help and boost and support the work that we've already done. And a lot of times I've worked with these people for like a year before they start a GLP-1. So really, really important. That base of support is really important before the medication. I know there's some controversy on if people can get off the medication. I think here driving home this point, if you get on a GLP-1, yes, all of the things can help. You're reducing food noise and you're reducing your appetite and you're reducing thoughts about food, and cravings and sugar cravings go down and alcohol cravings will go down. And you may have some food aversions, which is not great, but at the same time, if they're food aversions to foods that you want to eat less of, I guess that's helpful. But a lot of these clients majority of my clients who are on GLP-1s will say, I don't want to be on this for my whole life. And if the behaviors don't change, you're not going to have good success coming off the med. I mean, it's just, you have to change the behavior in order to get off the med. And even while on the med, you still have to change the behavior because there's a max dose that you get to. I mean, appetite control is only one thing, but you are still, what I'll say to my clients is, you are still who you are at the root of you. And so your behaviors are still going to show up. But if we don't deal with the underlying stuff, it's still going to surface at some point. Addressing the root cause is always, always, always going to be crucial on or off the medications. What the GLP-1s can't teach us is there's appetite suppression versus understanding. Understanding your body, understanding how your body functions. The medication helps to reduce the food noise, reduce the appetite. Your brain and nutrition counseling and internal work and behavior and understanding and observing your own behavior helps you to go, oh, I didn't eat lunch and I probably should have done that, and I do better when I eat lunch and I do better when I eat regularly. And that's why I'm looking at eating an entire cake right now, because I'm really, really hungry. Okay, that makes sense. I still need to do the basics. GLP-1s can't teach you your own pattern. They can't teach you how to eat healthier. They can't teach you how to say no to things that you really want to eat all the time. GLP-1s aren't going to teach you to get off the couch and to go exercise. They can't do all the work for you. You still have a lot of work. It's not the easy way out. GLP-1s don't teach you how to feel safe around food. I mean, they help, but when you come off the medication or the medication isn't as strong, are you still going to feel safe around food? It's really rewarding. One of my clients the other day said, I feel safe around food. I was like, I wanted to start crying. It was the most amazing moment. Like, we have worked so hard for this. GLP-1s can't help with emotional regulation. They can't do the journaling. They can't explore the emotions for you. They can't help you to feel the flow of anxiety and know it's going to come back down and you don't have to do anything about it. They don't teach you tolerance of those things. And GLP-1s don't teach you necessarily flexibility around eating. You may still have a lot of food rules, and the rigidity of your food beliefs are still going to be there. And that's where learning how to normalize food and have flexibility around food is really important. And again, a medication can't teach you that. Quickly, what I focus on with clients on GLP-1s who do or do not have binge eating disorder or emotional eating or impulsive eating. We focus on normalized eating patterns. We focus on reducing restriction, which is incredibly important, as I said earlier, because if you restrict, you're more likely to feel shame and guilt when you do let go of the reins a little bit. You're more likely, if you go into a meal more hungry, you're more likely to end the meal overly full. That's not your fault. That's the way your body works, and you're going to eat faster and you're going to eat more. So we work on normalized eating patterns, reducing restriction, normalizing blood sugar with the use of food, not medication, with the use of protein, carbohydrates, fats, regular meals, snacks, separating your urges from your identity. So personality traits versus an urge to eat something. Is it because it's there? It's right in the middle of your counter, because you have an emotional cue, because you feel like I can't control myself, and that becomes part of your identity. We decipher all of those things. And then building awareness without shame, which I think probably the base of my work really is reducing shame. There's no point in living in shame and guilt about food. I don't see anything wrong with any of my clients' behaviors around food. We're hard enough on ourselves about it. And so a lot of my work is teaching them to reduce that shame and guilt. We're human. We live in this flesh body that we walk around in. Our brain is not helpful sometimes. And it's going to think things that we don't want to think, and it's going to tell us to do things we don't want to do. And we need to learn how to live with that and not always act on it. And if it comes to food and we do act on it, not feeling shame and guilt about it, because we're human. For some of my clients, they may come in questioning, is a GLP-1 right for me? And for some of my clients, I may say, yes, but it's not the right time. And I think that's incredibly important. It's yes, but not yet. We have a lot of work to do first before we can bring that in so that you can have the best outcomes and feel the most successful. And if you are able to and want to get off the medication, that's an option too. Yes, but not always right now. As I mentioned earlier, some of the biggest triggers can be this all or nothing thinking. Make sure to hit the subscribe so that you know that the next video comes out, because it's going to be a really good one. And it is seriously one of the biggest things that impacts my clients' likelihood of success. All or nothing thinking. I'll see you next time.